Hello, this is Board Certified Family Nurse Practitioner Pattye Anderson, and I'd like to discuss with you today the evaluation and management considerations for neonates at risk for COVID-19. This guidance is intended to inform healthcare providers about the diagnosis, evaluation, infection prevention and control practices, and disposition of infants under 28 days old with confirmed or suspected COVID-19 or known COVID-19 exposure, including birth to a mother with confirmed or suspected COVID-19. Let's talk about routes of transmission. Transmissions of SARS-CoV-2, the virus that causes COVID-19, to infants is thought to primarily occur through respiratory droplets during the postnatal period when infants are exposed to mothers, other caregivers, visitors, or healthcare personnel with COVID-19. Limited reports have raised concern of possible intrapartum or peripartum transmission, but the extent and clinical significance of vertical transmission by these routes is unclear. Let's talk about clinical presentation and disease severity. Data suggests that infants under 12 months of age may be at higher risk for severe illness from COVID-19 compared to other children. However, information on clinical presentation and disease severity among infants is limited and based on case reports and small case series. Reported signs among infants with SARS-CoV-2 infection include fever, lethargy, rhinorrhea, cough, tachypnea, increased work of breathing, vomiting, diarrhea, and feeding intolerance or decreased intake. The extent to which SARS-CoV-2 infection contributed to the reported signs of infection and complications is unclear, as many of these findings can also be seen commonly in term and preterm infants for other reasons. For example, transient tachypnea of the newborn or neonatal respiratory distress syndrome. The majority of term infants greater than 37 weeks gestational age in these case reports had asymptomatic or mild disease and recovered without complication. However, severe disease requiring mechanical ventilation has been reported in COVID-positive neonates. Let's talk about testing recommendations. Testing is recommended for all infants born to women with confirmed or suspected COVID-19, regardless of whether there are signs of infection in the infant. For infants presenting with signs of infection suggestive of COVID-19, as described above, providers should also consider an alternative diagnosis to COVID-19. Discussing recommended testing, diagnosis should be confirmed by testing for SARS-CoV-2 RNA by reverse transcription polymerase chain reaction. Detection of SARS-CoV-2 viral RNA can be collected using nasopharynx, oropharynx, or nasal swab samples. Serologic testing is not recommended at this time to diagnose acute infection in infants. Discussing when to test, both symptomatic and asymptomatic infants born to mothers with confirmed or suspected COVID-19, regardless of mother symptoms, should have testing performed at approximately 24 hours of age. If initial test results are negative or not available, testing should be repeated at 48 hours of age. For asymptomatic infants expected to be discharged under 48 hours of age, a single test can be performed prior to discharge between 24 and 48 hours of age. Discussing prioritization of testing in areas with limited testing capacity, testing should be prioritized for infants with signs suggestive of COVID-19, as well as infants with COVID-19 exposure requiring higher levels of care or those who are expected to have prolonged hospitalizations, for example, greater than 48 to 72 hours, depending on type of delivery. Discussing limitations and interpretation of testing, the optimal timing of testing after birth is unknown. Early testing may lead to false positives. For example, if the infant's nares, nasopharynx, or oropharynx is contaminated by SARS-CoV-2 RNA in the maternal fluids, or false negatives, for example, RNA may not yet be detectable immediately after exposure following delivery. Let's talk about infection prevention and control. Given the paucity of information regarding signs of COVID-19 in infants, all infants born to mothers with confirmed or suspected COVID-19 should be considered as having suspected SARS-CoV-2 infection when the results of testing are not yet available. Infants with suspected SARS-CoV-2 infection should be isolated from other healthy infants and cared for according to the Interim Infection Prevention and Control Recommendation for patients with suspected or confirmed coronavirus disease 2019 in healthcare settings. This reading is available at the cdc.gov website. For healthcare personnel, recommendations for appropriate PPE are outlined in the Interim Infection Prevention and Control Recommendation for patients with suspected or confirmed coronavirus disease 2019 in healthcare settings, also available at the cdc.gov website. Let's talk about maternal-infant contact. Although it is well recognized that the ideal setting for health care of a healthy term infant while in the hospital is within the mother's room, temporary separation of the newborn from the mother with confirmed or suspected COVID-19 should be strongly considered to reduce the risk of transmission to the infant. Efforts are underway to address the knowledge gap of transmission between mother and infant during pregnancy, delivery, and in the postpartum period, and recommendations will be updated as soon as new information informing the risk-benefit of maternal-infant separation is available. Temporary separation in the clinical setting can be achieved in many ways, including a separate room, maintaining a physical distance of greater than 6 feet between the mother and infant, and placing the infant in a temperature-controlled isolate if the infant remains in the mother's room. For mothers whose test results are negative, separation precautions may be discontinued. Although temporary separation of an infant from a mother with confirmed or suspected COVID-19 should be strongly considered in healthcare settings, it may not always be feasible. For these situations, the risks and benefits of temporary separation of a mother from her baby should be discussed with the mother by the healthcare team, and decisions about temporary separation should be made in accordance with the mother's wishes. Considerations include clinical condition of the mother and the infant. Separation may be necessary for infants at higher risk for severe illness, for example, preterm infants and infants with severe medical conditions. Availability of testing, staffing, space, and PPE in the healthcare facility, and results of infant testing. If the infant tests positive for SARS-CoV-2, separation is therefore not necessary. If separation is not undertaken, measures that can be taken to minimize the risk of transmission from the mother to the infant include: mother wears cloth face covering and practices hand hygiene during all contact with the infant. Cloth face covering should not be placed on infants or any child younger than 2 years of age. Engineering controls like physical barriers are used, for example, placing the infant in a temperature-controlled isolate, and the infant is kept at least 6 feet away from the mother as much as possible. Let's talk about disposition and outpatient care. Infants who otherwise meet clinical criteria for discharge do not require the results of SARS-CoV-2 testing for discharge. Results should be communicated to the family and the outpatient healthcare provider. Parents and other caregivers should follow recommendations for infants with suspected or confirmed COVID-19 as described in the discontinuation of isolation for persons with COVID-19 not in healthcare settings, available for reading at the cdc.gov website. Infants with suspected or confirmed COVID-19 or ongoing exposure require close outpatient follow-up after discharge. For information related to the disposition of patients who have recently given birth, see Considerations for Inpatient Obstetric Healthcare Settings, available at the cdc.gov. Breastfeeding guidance is also available at the Interim Guidance on Breastfeeding and Breast Milk Feeds in the Context of COVID-19, available at the cdc.gov. Additional information for parents and other caregivers about the importance of well child care and information regarding feeding can be found on the CDC's Pregnancy, Breastfeeding, and Caring for Young Children website. Resources are also available on stress and coping secondary to COVID-19. References for this presentation are available on ResearchGate